up, we're talking about knees and elbows and that extra skin that starts to appear as we age. We're going to talk with an expert who knows all about how to fix that. Dr. Michelle Loeffler is a plastic surgeon and she's joining us now. Hi, Dr. Loeffler. Thank you so much for joining us today. The viewers have a lot of questions and hopefully you can answer all of them about cutting the knees and the elbows, which we did the elbow surgery together. And I'm still wanting to do the knees, but I want to tell our audience all about it.
Okay. Let me just start that neither of these procedures are very commonly performed, but a lot of my patients have had plastic surgery on various parts of their body, and all of a sudden their face looks good, their body looks good, but they notice some extra skin creping around their elbows. And I've been doing arm lifts for over 20 years, and the elbow lift is just an extension of the arm lift. We're removing extra wrinkles or skin above the elbow crease. And with gravity and time, everything sags down and there's wrinkles and skin.
Well, that's why I thought it was so great when I found you originally, because I had Googled and researched for a few years, because all of the surgeons that I found did the arm lift, but I only needed the elbow because the loose skin was really bad, but the rest of my arm looked great. So I was so happy when I found you and that you were able to do the procedure in your office with a local anesthetic instead of going through, general anesthesia or even twilight.
Right. That is the advantage. And when I do it, it's just numbed and you're removing the extra skin, usually a couple of centimeters. And the goal is to have a scar that's in one of the natural wrinkles. You don't want the scar to be too long, but you want to get enough skin that the elbow is tight, that you could still move the arm normally, and that the scar takes time to fade, 6 months to a year.
Yes.
And that's what I started with. An arm lift, then I started with an elbow lift. And then patients have come to me for years for thigh lifts. In the groin incision and along the inner thigh. So we took an extension there as well.
Yes. So now, when I went to do the elbow lift with Dr. Loeffler, I had been complaining about my knees, and she wanted to see how well I healed from the elbow before she would even attempt to do the knees. So the deal that we made was 2 years. And then I went back for another consultation for the knees, and my elbows they healed pretty well, I would say. I mean, I had to do some lasers, and then I did camouflaging for the scar. But I'm fine. I'm happy with it.
Right.
It looks great.
Everything's a trade-off. So when we usually do thigh lifts, the incision is in the groin, or even going up like jeans in the inner stem of your pants. Now, a knee lift is a more visible scar than a usual thigh lift. The same way an elbow lift can be more visible than an arm lift. So the concept of a knee lift is similarly removing the wrinkles, skin above the knee. The same way skin sags down and gravity and loss elasticity, the skin above the knee tends to be wrinkly. So like the elbow lift, most patients, we could do it under local anesthesia where you numb the area and remove the extra skin. But you're going to have a scar. The scar may be the length of the wrinkles you have now, and it could be a little bit longer because we're taking out, a greater width of excess skin.
So for somebody like me, I have loose skin here and then would want to cut, you're saying above, like a little bit above. Pinch the area of skin that bothers you. Like right here.
Right. So that's kind of how I start with my marking.
Yeah, like right here.
I pinch out the excess skin. I don't make an incision directly above the knees like the orthopedic surgeons. When they want to make like a Hollywood incision, they make a transverse incision. And we know transverse scars for the knees just heal better because we want the incisions to go against movement. So this incision is factoring in, starting at the lowest part of the wrinkles, and you're removing the extra skin upward.
Vertical, right? So this way.
So when you're pinching the skin, yes, and then you see as you pinch it out where that excess ends, and the end ends wider than the kneecap. I mean, it's going across the
so
thigh.
I have the loose skin all the way across. So here.
Yeah, and the incision's going to go across the front of the thigh.
Which I'm fine with that. So this incision would actually go here.
Yeah.
Right. Which I'm fine
At
with.
the right, look where the lowest wrinkle is. I see it on the other side.
Yeah, this one is more
right,
more
and then
pronounced.
you see that lowest
So this
wrinkle.
one's actually, so my right knee is worse than my left knee, so it's actually here.
Right, and that would be the plan. I mean, the scars.
So the scar would be in this area.
Exactly.
Okay.
You know, a little bit wider than you're doing with your finger, because the width of what we were removing, the length has to be about 3 to 4 times longer. So when you pinch out and you're like, okay, it's an inch of wrinkles, the incision has to be, you know, significantly.
So we're talking about an incision for like 3 to 4 inches.
Yes, that's
so we're talking.
We know medicine we usually use centimeters, but it's easier, for viewers to understand inches. Yeah,
which I'm okay with that, because for me, and my loose skin isn't as bad as it was. It was a lot worse before. I'm not sure why all of a sudden it's not as bad, because I've done filler, I've done the threads, which Drs. Loeffler and I discussed not to do them anymore, so she would have pretty much a clean slate to work with. But I think I'm okay with the 4-inch scar as opposed to having loose skin.
Right, and most patients that have come from both elbow lifts and any knee lifts, which is not commonly done, I want to stress that. I do way more thigh lifts and arm lifts than I do elbows, and knees are the least frequent of anything. I don't want people to think, oh my God, this is what she does only. But people usually have tried filler, they've tried laser, they've tried threads, and nothing's worked to the desire of my patients. Patients feel that the treatments were temporary, or they didn't do much, or they had infections and problems and lumpiness. And at times it makes my job much harder to remove the extra tissue, because there's scar tissue from these previously filled or injected products.
Yes, so it's better once somebody comes to you that they don't have, because I did the same thing with the elbow. Remember the first time we met, you wouldn't touch my elbows because I used threads and Sculptra, which was a disaster because it created the nodules. So we had to wait almost a year, I think, for those to go away. And with the knees, it was the filler and the threads, which I'm not doing anything now. Just
and it's a trade-off. There's scars are a big trade-off. Some people would stick with fillers and threads and lasers and wait for better devices to come up, because that's always an option. And some people are like, you know what, when my knee's bent and I'm sitting down, I don't notice it. I only notice it when I'm standing and wearing a skirt, of a certain length. So these are, personal decisions, and I know you're motivated to have it improved.
Absolutely. And also Dr. Loeffler was an expert in my book, From Bullshit to Botox. So she's great. She's a great surgeon. She always has great information. And what would you say like an ideal candidate would be for these procedures? Somebody who just can't live with the sagging skin any longer? Or
somebody has to be, as all plastic surgery, in good underlying medical health. And you have to have realistic expectations that we're removing skin and you're trading off a scar. A scar could be, thin. A scar could be pink, a scar could be purple, it could be a keloid or a raised scar, or the scar could be wide. You also have to be willing to limit your activity, because movement, flexing, walking, exercising, those things pull on the scar and can potentially open the incision or make a wider scar, and we don't want that. Smokers are not good candidates. People have to stop smoking. And you just have to be compliant and willing to understand that there are risks and trade-offs. And it is a procedure. It requires downtime, and it may take a year or even longer for scars to fade on the legs. The further you go from the face, the further down the body, the longer it takes for things to heal.
Oh, that's great information. So it does take longer for parts of the body as opposed to the face. I didn't realize that.
Yeah, the face has really good blood supply, and those incisions tend to fade by 6 months. But as you get lower, even when I do like a breast lift and a tummy tuck at the same time for mommy makeover, the breast scars fade faster than the abdominal scars. Same surgeon, same date, same patient.
I've noticed that, because I also did a breast procedure with Drs. Loeffler, and my breast scars are healed so well. Like they're completely have faded, but the elbow took almost 2 years. But I also worked on the elbow a lot with the CO2 and with V-beam, and also the camouflaging. With
the scars are going to be red. They're going to be pinkish
red.
Red. And I encourage taping early on, and then silicone treatment and laser is an option. And when things are really healed, if the scar is still visible, if makeup's not doing enough, there are tattooing or blushing that could help more permanently with the discoloration. So you have to plan. It's not just one and done, but there is a lot of time for healing to see the final results. And sometimes it needs a revision or a little touch up.
I think it's great. I think the procedures are great, especially if somebody doesn't need the thigh lift, because almost every woman that I know my age or even younger complains about their knees. Almost everyone. Like, that's what happens over time. And I hear a lot of people complain about their elbows. So when I talked about it in the book of cutting the elbows, people were like, oh, I didn't know that you could do that, because they're just used to seeing the arm lifts. So I don't think there are very many surgeons that do what you do.
No, I mean, I was lucky because when I first started practice, they just popularized laparoscopic bariatric surgery. So I was seeing tons of arm lift patients and doing big incisions. I didn't even do some of these big incisions when I was young, like in residency. They weren't as common. And I just was at the time that just became so popular. And I had a patient who was a non-weight loss patient whose elbows really bothered her. And she kind of was like, no, we're going to do this. And this is how we're going to do it under local. And, she knew that it was the first time I was doing the procedure. And she understood all of that. And then we just kept going with it because people came in and that was a complaint. And then I did a video about it. And that's kind of how we ended up here and how I met Sandy.
That's how, because I kept Googling. I'm like, there's got to be somebody out there that will just do the elbows. Like, it can't be, if you can do a whole arm lift, why couldn't you do the elbows?
That was my thought process to begin
which is
with.
Great.
And that's how that started. Knees, I'm not pushing knees. But
I know. I pretty much had to do some begging here for the knees.
Yeah, and as far as regular thigh lifts, thigh lifts take a lot to heal. When there's incisions for the thigh to lift the thigh up in the groin area, there's greater risk. There's infection risk that we have to worry about. There's even more movement. The knee itself, you just got to really avoid exercise. You don't want to walk around too much. I am not yet immobilizing or splinting anyone's knee. The elbow lifts, I usually do put people temporarily in a splint or at least a bulky ACE dressing to minimize movement over the area so we could get you the best scars possible.
But when you do the thigh lift, that doesn't really help with the knees, does it? Or does it?
No, the upper thigh lift doesn't get the knees addressed. Even when I'm doing a long thigh lift where the incision's going in the groin and inside the leg, the seam of the leg, it still doesn't address the knees. I mean, this is a direct excision of excess skin over the knee area.
And I know a lot of people believe in trying the lasers, and I've done that. I've done the filler and the threads, but for me, it just makes them look thicker. It fills in, but it fills in like where the lines are, but my knees overall look thicker.
Right, because you're filling, you're adding volume to the area. But some people may have success with biostimulatories like sculpture. Sculptures I don't find so predictable everywhere.
Exactly.
And this is an area of motion. Unlike putting sculpture in the face, even though the face moves when we're animating, this is more, it's going to be more involved.
Yes. Well, thank you so much for taking the time today.
Thanks.
And how can our viewers find you?
I guess, I'm old, so I still have a phone number and a website. so 212-355-0500. But you can follow me as Dr. Michelle Loeffler on Instagram, or go onto my website as well.
And you're in New York City, so anybody that wants a knee lift or elbow lift, Dr. Loeffler is your doctor.
Thank you so much for having me.
Thank you so much. This was great. Thank you.
Thanks. I wish you a successful show.
Thank you. If you like what you're hearing, then click that subscribe button and share this episode with a friend to help us grow our community. We'll be back in a minute to talk about body dysmorphia. This is an important topic you won't want to miss.